Alarming statistics from the CDC show that black women are 3 times more likely to die from childbirth than white women. A recent study also reveals that in 2021, black women had the highest maternal mortality rate, while Hispanic women saw a significant increase than previous years. The CDC also reports most pregnancy-related deaths are preventable. Black Maternal Health Week is now well underway. This morning, we're learning more about the importance of having an advocate. One of those many advocates are the multiple doctors and researchers working to find better solutions to reduce these alarming numbers of black maternal deaths. Joining us live this morning from Tufts University School of Public Health and Community Medicine is Dr. Vanessa Robinson. Dr. Robinson, thanks so much for joining us this morning. Let's start out with, why does this problem exist?
Well, in short, the answer is due to systemic racism. And it's been long overdue that we address the components of that. And I say, in short, systemic racism because it's way more complicated than that. But essentially speaking, there have been a lot of inequities that have occurred in society. And what we're starting to see is that it's bleeding on mothers overall, but in particular, black mothers.
Now, during your research, what is one of the most alarming problems that you and your team have discovered?
Well, one of the most alarming things that we've discovered is looking at how much this situation is preventable. I know you had mentioned earlier that CDC said that the majority of black maternal deaths are preventable, which is correct. I want to provide some statistics and rates to that. So, for instance, 85% of maternal deaths were found to be preventable as of 2021. So when we really think about that situation, that means that 85% of maternal deaths did not have to happen. When we look at our society, American society, we are very innovative. We are considered to be, the free world. And so when we look at statistics like that, it should not exist. And so we have to pay very close attention to some of the inequities that occur within hospital settings, but also in our environment as well.
Looking at solutions, what's currently being done to address this?
Well, you have advocates such as myself, scholars, community members, partners. What we're doing is we're really looking at black maternal health, not necessarily in a silo anymore, but we're really looking at the intersectionality of black maternal health as it relates to other public health fields of study. So, for instance, we're looking at how we can do a better job of destigmatizing black maternal mental health. We're also looking at the black mothers or the black birthing person's access to nutrition, looking at their access in particular to WIC and SNAP programs, and how those programs and the expansion of those programs may help to support access to healthy nutrition. As we know, the healthy nutrition helps to reduce the rates of preeclampsia, cardiac arrest, and preterm birth.
And when you look at this is more than a problem for just women. This is a family problem. What can families do, dads do, to help out?
Well, they definitely can partner with doulas. Research has found that doulas or access to having a doula greatly experiences the individualized experience of the birthing journey for the mother. And so just having that support system be present from start to finish. And when I say start to finish, I'm saying mother giving birth to postpartum, and really being consistent with that, being engaged, making sure that the right questions are being asked, knowing what you don't know, so that the next time you come before a provider or come before anyone that is involved with your partner's care, you're able to serve as her first advocate.
Dr. Vanessa Robinson, thanks so much for joining us this morning. For a full list of local events happening in South Florida to raise awareness about black maternal health, head to our website, cbsmiami.com.